Okay, so our patient is Lillian Chambers. She is a 40-year-old Korean American female. Her chief complaint is right lower quadrant abdominal pain after surgery for a ruptured appendix. The admitting medical diagnosis is ruptured appendix. The secondary diagnosis is drainage from her surgical site. The patient has no significant medical history, but after a diagnosis of ruptured appendix, an urgent appendectomy was performed. Her vital signs are a temperature of 97.8 degrees Fahrenheit, a pulse of 84, a respiratory rate of 18, a blood pressure of 120/74, and an O2 saturation of 99%. And her pain level is at 3 out of 10. The patient has a 18 gauge peripheral IV on her right forearm of 0.9% normal saline at 125 milliliters per hour. The patient's diet is ice chips for today, clear liquids tonight, and advanced diet as tolerated. The patient's activity is as tolerated. The textbook signs and symptoms of this diagnosis is fever, nausea, vomiting, and abdominal pain. The patient's signs and symptoms are a pain of 2 out of 10, bleeding and vomiting. And the treatment for this diagnosis would be an appendectomy and antibiotic treatment. The patient has no significant medical history and no surgical history was specified. And the patient is currently taking ondansetron 4 milligrams IV to prevent nausea and vomiting.